Hey guys, good afternoon, I guess it is. This is Bill Ellsworth, Equitable Life and Casualty. I want to thank each and every one of you for joining us here this afternoon. I want to talk to you a little bit about a Plan G that we're bringing out in the state of Missouri. Hopefully everything's going to be ready to go by July the 8th. That's our kickoff start date. I think we're going to meet that deadline. So we want to kind of give you some ideas of how this plan works. It is going to be different from the way the commissions are paid and several things like that. And as we move forward, all that stuff will be covered in the webinar. It's going to be a pretty short webinar. There's not a whole lot of differences between a Plan G and a Plan F. So let's go ahead and move through this here if I can get my screen to work. There we go. We want to talk a little bit here today about why we added Plan G to our Medicare supplement product line. I'm going to tell you why, and we think you want to take a look at it and sell that product, give you some ideas of where it fits, kind of compare a Plan G to a Plan F. I've got several examples at the end of the webinar that I will go through with you and offer you some sales ideas of how I market Plan G versus a Plan F. I'm not afraid of a Plan G. I hear a lot of times agents say, oh, I just sell Plan F. Well, my mother's on a Plan G. She's not had any problems. She's been on it for about 7-8 years now. So Plan G and Plan F, there's not a whole lot of difference. If you look at them on your outline of coverage, as we all know, a Plan F, the basic Plan F, not the high deductible Plan F, there's only one difference between a Plan F and a Plan G, and that is the Part B deductible of $147. Last year it was $140. A couple of years ago it was $162, and then it went down. So who knows what's going to happen in 2014. My guess is it'll go up a little bit, but it won't go up a whole lot. So when you're comparing a Plan G to a Plan F and you pull out your outline of coverage, you see you got one white square there that's not in colored in yellow, and that's simply the Part B deductible. Plan F pays it. Plan G does not. All other benefits are identical. So why would we sell Plan G? Well, first off, there's good benefits for you and the client. You know, the premium, I think, on Plan G, is with most companies, is taking less of a rate increase than the Plan F. In Missouri, as you all know, we're in a guaranteed issue state, and that, by the way, this webinar is strictly for Missouri agents or people who are licensed, maybe in Iowa that cross the borders, and Kansas and cross the borders. So there's not a lot of multi-states on this webinar. This is strictly for agents that sell in the state of Missouri and have to deal with the guarantee issue rule in this state. When the guarantee issue rule first came out, everybody thought, boy, that was a great, great deal. There was people on the other side of the fence said it's a great deal for a short period of time, but you wait and see what happens 5, 10, 12 years down the road. And what they predicted is happening. Our rates in Missouri for a Plan F are 20 to 30% higher than they are in Kansas, Iowa, Illinois, Arkansas, or any state that touches Missouri. We have guarantee issue. They do not. Our Plan F premiums are going through the roof. As I tell everybody in Missouri, we got the cream of the crop. So it's really, really affecting the amount of premium dollars that people are paying in this state. So there's a lot of good benefits for you. We'll get into why that is, why I feel that way, and why I think you guys understand what we're trying to accomplish here. But number one is we can underwrite a Plan G. Plan G isn't available for most guarantee issue situations. You know, in Missouri, I think probably 80 to 85% of all the premium sold in Missouri is a Plan F. There's about another 5% of that, or 5 to 10% of that might be a Plan N. And then there's about 4%, I think, Plan G premium sold in this state. So we as a company don't have to worry about getting the guarantee issue on the anniversary date. Now, we know we're going to get some, but you know, it's not like on Plan F where you got a person's got active cancer, or maybe they're on oxygen or kidney dialysis, and you can go from Plan F, from AARP to Mutual of Omaha, from Mutual of Omaha to Equitable, and whoever gets that unfortunate piece of business, it affects their rates. So, you know, with a Plan G, we're able to underwrite in probably 95% of all the situations out there. So if we can underwrite it, we think we can give you more rate stability going forward and you're not going to have to worry about going out and churning that business every 2 years because of 25-35% rate increases on a back-to-back basis. Or as a lot of my client will call and say, well, listen, I've got 2 rate increases this year from Mutual of Omaha on this Plan F you sold me. Is there anything else that we can do? So we feel as a company, we know we've had the actuary study this, we've looked at it. We think with a Plan G where we can underwrite about 90% of that business, we're going to be able to say, yes, we'll take it, no, we won't. And by being able to do that, that gives us the flexibility to manage our rate increases, and we should be able to keep those at a minimum. You realize our Plan F just went up about 25%. That was the first rate increase since June of 2010 on that block of business. However, clients don't remember that. They just remember that new big rate increase they just got. So that's one of the reasons why we're introducing the Plan G. Now, just so you know, as a company, we are thinking 2, 3, 4 years down the road of what we're going to do for Medicare Supplement in each one of the states that we market this piece of business in. We're also looking at an association Plan F coming down the road sometime maybe in 2014. That's basically the same thing Mutual does with all of their different companies. They got, for 1 year they'll have United of Omaha, then Omaha Mutual, and then Mutual of Omaha, and so forth. They just come out with new names for new products and new product offerings. So that's where we're headed with this, and that's what we're looking at in the future to keep you guys competitive in the field. One of the things that we really like about this plan is that it's going to be level commissions years 1 through 6, and as you well know, a lot of the companies in Missouri, and there's one out there right now, I'm not going to mention any names, that's going to pay level comp on new and replacement, and you and I both know that'll last a short period of time, but it's a short-lived product. But what we're going to do with this product is we're going to pay you a level commission years 1 through 6, whether it's new or replacement, so that you don't have to worry. Like I'll just take my own contract with Equitable on my Plan F. I think I'm on like an 18, and on the second year, whether it's new or replacement, if it's new business like turning 65, say it's 18. But in year 2, it cuts in half and I get 9. I got a lot of business renewing at 9%. So we're not going to pay a percentage on this. We're going to pay a flat dollar amount like AARP does on their plans, and you won't be disappointed when you see the street contract on this. I'm not going to go into contract levels here today. We may have LOAs on there that the agency's buying leads and doing a lot of different things for them. So, the commission's just going to be whatever you get the first year, you're going to get years 2, 3, 4, 5, and 6. And again, that's even if you're doing a guarantee issue Plan G to Plan G. So we think that's beneficial to our sales force. We're, of course, going to stay with the 12-month advance as we're doing on all of our Medicare Supplement business. So you write an app, you get full year's commission paid. The Express app, if you've listened to webinars that I've done in the past, you know that the Express app process is something that you can use to your advantage. On the Express app, you can still call in and get a policy approved right then and there and get your policy number established and in your hand at the end of the phone call. By doing that, you guys definitely can eliminate a lot of buyer's remorse. If you haven't set in on an Express app webinar that I do, we send out those emails and e-blast on those all the time. And if you haven't been in on one, you need to listen to one, or you can email us and have us send that to you in PDF form. We can do it that way also. But the Express app process has a lot of advantages for our sales force. I always use the example at the end of the month. Say you're sitting there on the 28th day of the month, and you're sitting there with a man or a woman that's facing a large rate increase at the very beginning of the next month. You actually can call, get that policy approved, call the other company and cancel it, and they won't have to pay that rate increase. No other company I know can do it like we're doing it on our Express app process. We get a lot of good feedback on that. We still have this product available to sell over the telephone so that you can get the same result with the Express app process. It actually is an Express app process. It's just some people do it face-to-face, and then we have a lot of agents that do it over the telephone. So either way, you will get your immediate results for your client. Another thing that we definitely want to talk to are the baby boomers turning 65. Guys, don't forget, baby boomers have major medicals, group hospital plans. All of those have deductibles, usually in the $2,000 to $5,000 range. They're not going to be scared of a $147 Part B deductible. They're used to deductibles. They're used to co-payments. A Plan G is a great fit for people turning 65, and with our growing market in the baby boomer generation, as you well know, you got 10,000 people a day turning 65 in this country, and that will continue for probably 17 to 19 more years, which is an amazing amount of people. We still offer, well, let me back up. The Plan G is going to have a 7% household discount applied to it. So it can be two brothers, a brother and a sister, man and his partner, a woman and her partner, whatever. As long as two people live in that household, they will acquire or be able to get the 7% household discount. And only one person need apply to receive that discount. Now, in several other states, I think there's 7 other states that we offer a household discount on our Plan F, but both people have to apply on that. So this is different in Missouri. You know, we're trying to get you guys very competitive now and in the immediate future, and by offering a 7% household discount to the already competitive rates, and when only one person has to apply, we think that's going to be really beneficial for all of our sales force. Where does the Plan G fit? Well, to me, there's a lot of different good areas that you can put a Plan G in. Definitely people who are in relatively good health and can pass our underwriting. You know, those are good risk people that we want to take a look at. As you well know, the Plan F is continuing to go up in this state. And again, guys, gals, that's because of the guarantee issue rule. Companies cannot underwrite. And listen, I'm a salesperson just like everybody on the end of this telephone call or this webinar. I have been since 1984, and I have always sold a 100% plan, and I've always been very fond of that. Plan F is going to continue to go up because it's a plan. If you look in your healthcare buyer's guide for people with Medicare, Plan F is a guarantee issue product. Plan G is not. So what does that tell you and I as salespeople? Well, number one, if Plan F is a guarantee issue, that means the company cannot underwrite it. Plan G is not a guarantee issue, so we can underwrite it. You and I are fairly intelligent people to be in this business, so wouldn't you say that that makes sense to us, that a Plan G, if it can be underwritten, probably is going to have a better chance of not having massive rate increases going forward? And that's what we're after in Missouri. I know if you guys have been in this business as long as I have and you've been selling in Missouri, you're tired of having to go back and continually sell the same dirt over and over and over. You know, when we first started doing that, we got paid a level commission. Now we're getting that commission cut in half. Here's a way, guys, that if we can get you guys out here to buy into what we're showing you, and when I show you the rates, I think you'll buy into it pretty quickly. But it's a situation where you should not have to go back and continually churn that business because your client are calling you and saying, hey, you know, this Plan F just took a 25% rate increase. If a Plan F starts out 20% higher than a Plan G, and they both have a 20% rate increase, your Plan F client holder is going to get a bigger pop than your Plan G because of where both plans started to begin with. So anyway, you're always going to see, as long as we have guarantee issue, the Plan F is going to continue to go up in this state, and we think we have a way now to get you a Plan G that's almost identical in coverage to where you can keep your clients satisfied and not have to go back and continuously churn that to the next best deal out there every year when new companies come on the market. Another good fit for this is somebody that maybe has a plan in and they're not satisfied with it. They don't like the deductibles or the co-payments. So that might be a good fit. You may find that their Plan N is even higher than our Plan G when you get to looking at these rates. If they've had, say, the mutual plan that came out and they guaranteed issued that, they didn't underwrite it at all, and those plans were continuing to go up. So if you're running into people who have a mutual plan in, I assure you this Plan G's more coverage and going to be either more or either less or about the same premium. So that would be a good fit for it. Somebody that's new to Medicare, again, these people are used to high deductibles and co-insurances. And even people who have a high deductible Plan F. Now, you don't see a lot of that out there in Missouri, but you do run into it now and then. Maybe you got somebody moved in from another state. Currently, I think the deductible for the high deductible Plan F is about $2,100 if you divide that by 12. That's about $175 a month if they're paying a $50 a month premium and they have a bad year. It costs them $225 a month to own that high deductible Plan F. So anyway, those are just some good places as to where that product will fit in and how that can be beneficial to you and I as salespeople. Now, what I have done is I'm going to give you a way to show how apple to apple Plan G and Plan F are the same, because I'm going to add the Part B deductible back into it as I go through my examples here. So I'm a huge legal pad fan. When I'm trying to explain the benefits of what I'm marketing compared to what they have, I always draw it out on paper. I'm kind of a simple guy. If I can see it with my eyes, sometimes it's a lot easier for me to understand. So I'm going to start out with a Mutual of Omaha Plan F. And in Missouri, if you get your rate sheet out, that's $144.12. If you take the 12% discount off, that brings her back down to $126.82. If you take that figure, that $126.82 times 12 months, that means your client for that policy to own it is going to cost them $1,521.84 a year. Okay, so I went into the Equitable new Plan F or Plan G, and it starts out at $118.42. Again, this is a female, age 65, and you take the 7% discount, just like I took the 12% off, so I'm assuming a man and a woman, and give the 7% discount on our plan. That brings us down to $110.13, and you take that times 12, that's $1,321.56. That's a difference between those two plans of $200.78. Now, to get apple to apple, I have to add the Part B deductible of $147, or subtract that off of that. So I'm saving the client $53.28 apple to apple. No, in this comparison, that means there would be absolutely no difference in the two plans, because I did put the Part B deductible on to say, I took that and took it away from the savings, and that brings me down to $53.28. No big deal. Again, I'm showing you an apple to apple comparison. So then I take the husband. He's 65 years old. He starts out at $166.25. You take the same example, give him the 12% discount, brings him down to $146.30, and take that times 12. He spent $1,755.60. On a Plan G Equitable, 65-year-old male in the lowest zip codes, 136.17. Take off the discount of 7%. You're at $126.64. Take it times 12, you're at $115.1965. That is the difference of $235 if you add the difference between this plan and the other plan. Now you take the Part B deductible away from that because they had to pay that, so that's out of their cost. They now save $88.95. So you add the $88.95 savings on the man's plan, add the $53.28 that the lady saved, apple to apple, the two plans, there's $142.23 difference in the two plans. Now, that's how it works if you just go apple to apple. But guys and gals, that's really not what you're going to run into that much out there in the sales field. What I want to show you now is what I got a phone call on yesterday from one of my own clients, and it went just like this. I had a man and a lady, husband and wife, call in. I'm not going to give you their names because you'll all be calling on them. They live in Missouri. He is 71 years old, and she is 67. This is what you're actually going to run into, and this is going to make a lot more sense to you. You're going to run into people out there that's had their Plan F for 3-4 years, and it's went up that 25-35% year after year after year. So this guy started out, and his premium now has advanced up to $209. I hit the wrong button, sorry. His premium is now, for a Plan F, $209.34. His wife started with me when she was 65. She's now 67, and her premium is now advanced to $179.84. So you add those two numbers up, you come up to $389 a month. You take that times 12, you're about $4,670. I quoted her a Plan G, and they're both in good health, so I know they can qualify for it. For the Equitable Plan G, he starts out at $170.50. She comes in at $132.59 for a total premium of $303.09. Now, since it's husband and wife, I can give them a 7% discount. That reduces the premium down to $281.87. Take that times 12. That's $3,382.48. Okay, so that's a savings. If I subtract the $33.82 from the $46.70, I come up with $1,287.68. Okay, so they both have to pay the $147 deductible. As you can see at the very bottom there, I took $294 on there. That should be a minus. I don't know why it's got a plus there. It's got a minus there of $294. That's their $147 apiece that they both have to pay under a Plan G. I'm still saving them $993.68 a month, or I mean a year. That's pretty darn good savings. That's about $80 a month, and I'm giving them apple-to-apple coverage because I put the 147 back in my example. So they got the same thing, and dollars are dollars, and that's what you're going to run into out there in the sales field. People that have had a Plan F for a lot of years, and if you run into a husband and wife and can not only, before the discount, I'm about $80 a month, about $86 a month less, but then you add that 7% discount on a husband and wife, and it really gets competitive as to what you can save your client. So basically what we're showing you here, guys, is just get creative, get your legal pad out, draw some examples so your clients understand, apple to apple, I'm getting the exact same thing. It's a fair comparison when you put that 147 back in there. So anyway, that's kind of how I look at it. I hope you guys understand what I'm trying to get across here. But as far as I'm concerned, it's all about the numbers. The benefits on MedSup are all the same. So if you're sitting there talking to somebody and our Plan G is more than $12.25 less than what they're currently paying, if their Plan F is $12.25 a month higher, then you should consider looking at a Plan G. Explain why Plan G premiums should be more competitive through the coming years. Just like I'm doing on this webinar, Plan G, as a company, we can underwrite it. Plan F, about 50 to 55% of all the business we get, we don't get a chance to look at the health, so we have no control over the claims loss experience. And that's kind of why, if you take a look at Plan G as to why it is going to be a very, very good deal for you and your clients going forward. It'll save you a lot of time and money if you don't have to go back every year to 2 years to replace it. You're out selling the same dirt. You're spending the same gas over and over and over again. You can take that time that you're going back to replace a Plan F that's went up 2 or 3 times to maybe go see somebody new and add more people into your portfolio. So anyway, get creative, use your legal pad. Try to explain to these people why Plan G should be a better buy going forward than the current Plan F. So anyway, if you have any questions, I'm going to open it up here just a minute to questions. The Plan G in Missouri, there's just these are the lowest area factors with the household discount. A 65-year-old female should come in at just a shade over $110. If you go up to age 75, we're still down to $154. You and I both know if you look at age 70, we're 5 years into it, especially in the male category. Look at most rate sheets for a 70-year-old male. You're getting up around $200. So, that's a lot of money difference in your client's bottom line. So, look at these figures. If you don't have them, we can get them to you. If you need a sales kit or need anything else like that, get a hold of Kevin or Ginger, kevin.williams@equilife.com or ginger.abbott@equilife.com, or call 877-579-3751 and ask for the outlines of coverage, sales kits, whatever you need. We'll get them to you. or if you need copies of the webinar, we can send that to where you can use these examples. If you need to get a hold of me, my name is Bill Ellsworth. You can get a hold of me at bill.ellsworth@equilife.com. You can't get a hold of Cindy just now. She is on vacation. If I could give you her personal phone number, you can call her at Lake of the Ozarks, but then she'd shoot me when she gets back, so we better not do that. But you can still call 800-352-5121, and we can get everything in your hands that you need. So with that said, guys, I appreciate you joining us. I know it's a late notice, 4th of July holiday weekend. I hope everybody has a great weekend. I hope when you come back to work Monday, everybody's got their fingers and toes. Don't want any of that going on, so be safe. I'm going to open it up now to questions from Gershon. So, Gershon, if we have any questions, go ahead and get those read back, and we'll get these guys out of here. Or maybe it's Shauna. Shauna, are you on there? Hang on for 1 second, and I'll see if I can get them to answer. Well, I found Gershon. She was drinking again. I don't know what she did.
I'm sorry. I had to take a message to Todd. I'm so sorry. So sorry. You did have questions. Let me get to the first one. The first question was, what about moving a Equitable Plan N to an Equitable Plan G?
Plan N as in Nancy?
N as in Nancy.
As long as they can pass underwriting, that's okay.
Okay, and the question that was with that, he wanted to know, commission-wise, what will the change be on commission?
You need to, I'm not 100% sure what we're doing there. I know from a guarantee issue Plan G to a Plan G, we are paying full comp, but I think if you're doing an intercompany replacement, I think it is reduced, but get that email address for Sean, and we'll get the exact amount and get it to him. But
Okay.
That's not something we want you to do if you can avoid it.
And the next question I have is, when are the Plan G rates going to be effective and for us to look at?
July the 8th. I think we're probably going to post them on the web on the agent website on Friday, guys. So I think you'll be able to download supplies then.
And that was the next question regarding supplies.
Well, I'm good. I'll answer two at once.
Imagine that.
What else we got?
Okay, the very last question they want to know is, can they still yet continue using the Missouri Equitable supplies if they're not writing Plan G?
You sure can. When you order new supplies, the only difference you're going to see, the application is a little different because we have to put the Plan G on there. My idea was, why can't the agents just draw a little box and check that? They didn't think that was funny, but I did. But anyway, the new app will disclose all that, and it'll show a place for the household discount for husbands and wives. So we will eventually just phase those other apps out because it's basically the same thing. So yeah, just keep using what you got. But if you're going to do a Plan G, you got to have the new app.
And that actually was the last question.
All right. Hey, guys, again, have a safe weekend. Enjoy the holiday, and we will talk with you the next time. Appreciate you joining us. Thanks. Bye. 30 minutes, baby. Oh, well, as long as you're working, that's one thing.